Hello, friends. This is Dr. Jose Luis Ruiz, Director of the Los Angeles Institute of Clinical Dentistry. And this is the next installment of Dentistry Today, Adhesive Dentistry Magic, which is a series that we have created to share with you how adhesive dentistry, super gingival adhesive dentistry, should make our dentistry easier, faster, better, and more predictable. And this time we're going to be talking about bonded cementation of onlays. Now, this procedure should really be simple. A lot of people feel very trepidation when they're thinking about doing something like this, but I'm here to tell you that bonding an onlay using modern adhesives should be simple, should be fast, should be pain-free for the patient, and that's the benefit of using all these modern materials. I mean, technology needs to make things simpler and better and faster. So some people, some groups like to overcomplicate things. For example, the biomimetic group that they like to insist that the only way to do good adhesive dentistry is using a rubber dam, and that's not based on scientific principles. 20 years ago, I wrote an article on this, and the literature is very clear. Achieving isolation is indispensable, but how we do it's completely up to us, and there's no clinical research showing the rubber dam is better. So all of this is in my book, Super Gingival Minimal Invasive Dentistry, and this book was done with Dr. Ray Bertolotti, published by Wiley, has a lot of very valuable information. But let's do it. Let's do it together. The first thing I'm doing here is I'm anesthetizing the patient using my supraosseous technique. Within 1 minute, I can start working on the patient. You want more information? I've written an article. Um, and of course, our website, Ruiz Dental Seminars, has a video with a lot of explanation on this subject. Of course, now you see me cleaning the tooth, getting rid of all the excess cement, and of course, up to that, we should try the restoration. If there needs, the better the lab, the less adjustment, and I'm big on using a very high quality lab. So my restoration fits perfect. The contacts are perfect. Sometimes you have to adjust, but most of the times, because of this, I don't have to do much adjustment as it is in this particular case. The floss snaps beautifully, and I'm very happy. And now I'm ready to do the next thing, which is clean the tooth using katana cleaner. Katana cleaner is an excellent cleaner that removes leftover cement, leaves the tooth really clean and ready to go. And you can use the same katana cleaner to clean the residue that is left on your intaglio of the restoration. It works beautifully. Of course, your restoration has already been etched by the laboratory. After using katana cleaner on the restoration, wash, bone dry, and then ceramic primer, also from Curare. Excellent materials that make things very simple and very successful. Then also from Curare, I use my favorite bonding system for a lot of reasons, which we don't have time to discuss. I'm going to etch the enamel selectively for less than 10 seconds, between 5 and 10. Wash, dry. How much I dry doesn't really matter. Then I'm going to apply my primer for 25 seconds, and then the bond. Uh, um, you'll see me do that in just a second. Of course, the cement that you want to use should be a dual cure. My two favorites right now is Panavia B5 from Curare and Visalis Semcor from Kettenbach, both excellent resin cements. So now you can see right here the procedure being done. Selective etching of the enamel, mostly on the uncut enamel, which is the one that can get the staining. And stay away from the dentin, of course, and between 5 and 10 seconds. It's a quick thing. Then immediately isolate. I don't waste any time. I don't want any contamination to occur. So as soon as I, etch and immediately isolate. But of course, I'm going to use cut and roll isolation, and then I get on it. I mean, there's no reason to waste time. Immediately I dry. How much I dry doesn't matter, as I said, because I didn't etch the dentin. So you can dry as much as you need until it looks frosty. The enamel looks frosty, and immediately, as you can see, I'm applying my primer. This is the first component of the Curare bonding system. I put lots and lots of primer. I rub it, and I'm gonna do that for between 20 and 25 seconds. Then I'm gonna air dry, making sure that it's only air that comes out. And then I'm going to, evaporate all the solvent until it stops moving. When it stops moving, I apply my bond, and usually air thin it, but it's in this particular situation, since I'm gonna put the cement, then it's not quite as important. Then the assistant puts the cement on the restoration, plentifully, by the way. You see a little drop of blood, that's from the injection, on the injection site, not important, nothing to worry about because it's not on the tooth. And then I press it, wipe the excess. This is real time, friends. This is what I do every day. I've done 20,000 plus 20,000 onlays in my career, and I can tell you this is easy and fast and very successful. So I do a full cycle facial, a full cycle lingual, and because I use Avalo Light, a full cycle means 3 seconds. That makes the cement hard, but not super hard. And we want to remember the resins have timing. It doesn't. The second that it hits the light hits the resin, it starts curing. But the longer you hit it with the light, the faster you're gonna make that setting occur. So I like to cure, a little bit at a time. And that minimizes the effect of polymerization shrinkage, and it also makes cleaning cement a lot easier because then cement is not super hard. Now I'm using the number 12 blade, and I will create bleeding. I remember I already cured, so I'm not concerned about any bleeding at this point. It's already sealed. The resin is already sealed there. So the only thing I'm doing is just making sure that I get rid of all the excess cement. Most of the cleaning is done with my number 12 blade, and I use a two-handed technique for absolute control, whether I'm cleaning the facial part or the lingual, the interproximal. I use my number 12 blade. It cleans the cement beautifully. It doesn't take chunks out. It actually cuts the cement at the margin level, so your margins tend to be glass-like, beautiful. And it's usually all the instruments that I use, just the number 12 blade. At the end, I will polish, of course, with my Softlex disc and cups. But after I do the gross cement cleanup, which most of the cement is gone by now, then I will use my final cure with oxygen inhibitor. If the flaws didn't go through, I will use the Cerisol from Denmat, and within seconds, I will get rid of that interproximal cement. Get rid of the oxygen inhibitor. That gives me the absolute best cure. And the last thing is bite adjustment. So this was done very clear. This is real time, friends. We at the LA Institute, we teach a class on bonded onlays, and I can tell you it's a very, very practical, real world class, and I really look forward to seeing you there or on our next little clip. Thank you.